Happy Monday to all of you. Have you ever heard of lipedema? I hadn't, and if you have not heard of it, I know you know someone who has it. It affects nearly 10% of women, but it's often misdiagnosed. So this morning we are happy to have Dr. Thomas Wright with us. He joins us to talk about the diagnosis and also the treatment of it. Good morning to you, sir.
Good morning.
I think first and foremost, I have to ask, what is lipedema?
Okay, so lipedema is a subcutaneous fat disorder, which causes abnormal accumulation of fat on the arms and legs in women. Its onset is usually after puberty. The shape of the women change and can progress through their life. It can cause symptoms such as leg heaviness and tenderness, and it can become progressively disabling, affecting mobility.
And we're seeing a couple of graphics on the screen, and they will continue to change as we talk about this.
Yeah, so this graphic here, it shows on the far right, the lady there, that's the most extreme. There's different stages, but you can see that she has lobules of fat on her legs, around her knees, on her thighs, and lateral thighs and inner thighs. And then the middle stage is someone who is actually anorexic but still has this fat disorder, lipedema, and so she has large cuffs of fat around her ankles and large thighs, and yet is still malnourished. That is
crazy to see those pictures. How is it, though, different from obesity?
That's a great question. So it's metabolically completely different from obesity. So the fat, the fat is insulin sensitive, super sensitive. It's almost like I call it their superpower, because if they eat carbs, the insulin deposits fat much more readily than a normal person, and it deposits in these legs and arms, and so this fat is relatively resistant to diet and exercise.
And you could imagine the women who do have this are so frustrated. So what are the treatment options?
Well, of course, the treatment starts with conservative measures like diet, which emphasizes a low-carb diet or like a diabetic diet, compression because they get secondary swelling, and then one of the most effective treatments is a lymph-sparing liposuction. So it's different from regular liposuction in that it takes extra care not to cause any injury to the lymphatics, because this disease can also put stress on their lymphatics.
And as we said at the beginning of this segment, even though you've never heard of this, there's a chance that you know someone who has it. And I can think about a couple of women that I know that suffer with something like this, and it's just so frustrating. But there are options.
And so there's unfortunately, there's very little awareness for this, but there are good treatments, and you know, not everybody at different levels, and they really can help.
Absolutely. So if you are looking for some help, or you know someone else who is, mention Laser Lipo and Vein Center to that person. They are located in O'Fallon, Missouri. The website is lipedema.net, or give them a call at 636-397-4012. Kent, so many times when we speak with medical professionals, we always say the first step is making that call.
Yeah, interesting. Boy, the one with the anemic person, that was amazing to see.